So there's two joints of the pectoral girdle. The first one we're going to be looking at is the sternoclavicular joint, and that is a synovial joint between a few different parts. We've got the clavicle, and specifically the medial end of the clavicle. That also articulates with the manubrium of the sternum, and not all of it, it's just the superior and lateral part of it. That's what articulates with the medial end of the clavicle. And the other thing that's part of this joint is the first costal cartilage. So altogether, they form the sternoclavicular joint. It's a synovial joint, but it's a little bit interesting because it's all covered by fibrocartilage, the bony surfaces, not actually hyaline cartilage. And that's a bit weird because usually synovial joints have the hyaline cartilage covering the bony surfaces. But in this case, we have fibrocartilage covering them instead. Now, there is a actual fibrocartilaginous disc between the clavicle and the manubrium, and that actually splits the joint into two different categories. Now, this disc is attached to the capsule and also the first costal cartilage, and that sort of makes a cavity in front and behind that disc. It's a pretty strong joint, to be honest, and it's mainly from all the ligaments surrounding it, the capsule, that makes this joint very, very strong. It's worthy to note, though, that the clavicle is not fully articulating with the manubrium. It's only the lower half of that bone that actually connects to the part of the manubrium. And you can see that in this picture here, that the lower part of the clavicle is actually in that little notch there, that little part of the manubrium that actually is forming part of that sternoclavicular joint. The rest of it, it's not articulating with that surface. In terms of the ligaments, there's a few different ones that we've got to stabilize this joint. You can see here the main one is involving the clavicle and the manubrium, and they're the sternoclavicular joints. You've got anterior fibers which sit in front, and then posterior fibers which sit behind. So you've got the anterior sternoclavicular ligament, and then you've got the posterior sternoclavicular ligament that just sit in the front and the back of the joint, respectively. The other ones that you have is actually one that connects the two clavicles via the jugular notch. The jugular notch is that little indentation that you can feel in your own self if you want. It's the top part of the manubrium. It almost has like a U-type shape, and that actually connects the two clavicles with the jugular notch, so the manubrium, and that provides stability that way. The other ligament, which is actually the strongest ligament out of all of these, is the costoclavicular ligament. And as its name states, it goes from the clavicle to the costal cartilage. Now, the reason that this ligament is so strong is partly due to having two different bundles which actually go in opposite directions. So the anterior bundle is the more superficial of them. It's the one on the front, as its name suggests, anterior, and that runs upwards and also laterally. So you can see that in this picture here. The back fibers, the posterior bundle, runs upwards as well, but actually runs medial, so the opposite direction of the anterior bundle, sort of like crossing over each other, making the joint even more strong and stable because it's got supports in two different directions. So the anterior fibers run upwards and laterally, and the posterior fibers run upwards but then medially. A good way to remember this is essentially just remembering the intercostal muscles, and they match those. So they match the same direction of how the fibers run. The external intercostal muscles are the ones that are more superficial, so they would actually mimic the anterior bundle of fibers because they're more superficial. They're on the front, and the external intercostals are also on the front, and they run upwards and then laterally. So you can see that there. The internal intercostal muscles essentially follow the posterior fibers of that costoclavicular ligament, and they run upwards but medial. So that's a good way of remembering the direction of those fibers. In terms of the nerve supply, you can see here the nerve supply of the joint is from the cervical plexus, and you've got a few different supraclavicular nerves that come out of that plexus. You've got the medial, the intermediate, and the lateral ones. And you can see here that the medial supraclavicular nerves are the ones actually going towards the joint. And that makes sense because they're, above the clavicle, they're coming down and they're going to the medial aspect of that area. So you can sort of guess that that's the nerve that's going to supply them, because that's the direction that they're coming in. They're coming from above in the cervical plexus, and they're going down and medial. You can see from this diagram. And the nerve roots of that are C3 and C4. You can also see this demonstrated here. You've got the medial fibers, the lateral fibers, and then the intermediate fibers of that supraclavicular nerve. In terms of the movements of the sternoclavicular joint, there's a few different ones to be aware of. The main one it does is just facilitate shrugging and depression of the shoulders, so shoulder elevation and shoulder depression. You can also have forward and backward movements of the shoulder itself, so essentially protraction and then retraction. And then it also facilitates abduction and then adduction of the shoulder back down. So that's when the arm is actually above the head and then coming back down. And it's important to note that it just sort of moves on the disc itself, the clavicle. The sternum stays fixed, obviously. And in terms of the rotation aspect, the clavicle doesn't rotate. There's no rotatory muscles for the clavicle. It just stays fixed and moves with the scapula. That's how it actually rotates forward and back. The other thing to touch on, just as a clinical takeaway, is that this joint is super, super strong, and the main ligament that contributes to that is the costoclavicular ligament. That transmits all the energy, all the force from the clavicle into the costal cartilage, and it sort of takes away the pressure from the joint. And in terms of dislocation, it's very, very unlikely for this joint. It's actually more likely that the clavicle breaks instead, and that's usually what happens. We've got an example of that happening right here, where the joint is intact after some trauma, but the clavicle is actually broken. All right, next up is the acromioclavicular joint.